Mother, wife, sister, daughter. Survivor, coach, teacher, lover. Doctor, fighter, nurse, writer. Auntie, wifey, proud, feisty. Bestie, husband, God. Hello, hello, and welcome to When Docs Talk. How is everyone doing today?
Well, doing
For
great.
those of you who are watching us for the first time, we're hoping that you're well too. We're going to tell you a little bit about ourselves. We are When Docs Talk, and who we are is a collaborative of emergency doctors and practitioners dedicating to bringing you information and sharing our experiences and expertise. We love learning from you too. So that's part of what we do here at When Docs Talk as well. And we love our nurses as well. So we always phone a friend who's an RN. So you'll meet our RNs who are on board too. Now, we are based here in Atlanta, but we actually hail from all over the United States and actually the world. We are going to discuss with you a number of things, but we had to start with COVID, right? It's on my mind, it's on your mind, it's on everyone's mind. It's kind of turned our world upside down. So we decided to start with the COVID-19 series. And in that series, we started off with women and COVID-19. For those of you who were able to join us on Monday, we started our series, and this will be the conclusion of women and COVID-19. But that's not going to be all. We're going to talk about how COVID-19 has affected the way we interact with each other when we talk about sex, love, dating, and intimacy, and COVID-19. We'll talk about what people are doing or not. We'll talk about how COVID is basically throughout the world. We want to know what the world looks like with it. So we'll have the global response. That's another episode that we'll be talking about. And we'll talk about the intersections of race and ethnicity as they relate to COVID-19. So this is going to be our women's series. It's part 2. We thank you for joining us again. Let's go ahead and introduce our whole crew. Some of us you met last time. I'm Dr. Edidiong Ipe Ekbo. Dr. Didi, Dr. Edidiong, Dr. Ipe, it all works for me. I'm a board certified emergency physician. I'm also board certified in internal medicine. I'm from Miami, Florida, born and raised. Both of my parents are from Nigeria. And I'm very happy to be here with all of you out there. Thank you for watching.
Good evening, guys. I'm Liz Elidari. I'm also a board certified emergency medicine physician. I work in Atlanta as well, and I have a passion for underserved patients in medical education. Excited to be here for this segment.
Hey, everyone. I'm Tawny Jackson. I'm a travel emergency physician, born and raised Jamaican, lived in Atlanta in the residency era, and I've been sticking around. Happy to see everybody this evening. We're going to have a great show.
Hello, everyone. My name is Davita Pete. I'm an emergency and trauma nurse. I'm originally from Memphis, Tennessee, but I came to Atlanta for college, and I just made Atlanta my home. I've worked closely with Dr. Ipe over the last few years since I've been a nurse, and when I heard about the WDT project, I definitely want to jump in. I'm excited to be a part of the team.
Hey, we're so happy to have you too. And we see from the front lines, directly from the front lines, we have our last host. Tell us what's going on.
Hey, so I'm Dr. Sonia Pinson, and I am a family medicine provider and board certified, but I am working in an ER setting. Also, I am 9 years U.S. Navy veteran. I'm very proud of that. Born and raised here in Atlanta, Georgia, and raised in Peachtree City. Sorry that I can't be here for the entirety of the show, but I'm glad that I was able to say hi and hello to everyone. And excited about this show this evening in the discussion, because I think it's really insightful, thought-provoking, and it's going to be very impactful tonight. So it's going to be a great show.
Thank you. I think it's going to be a great show too. And thank you for checking in with us, even though you're all the way there. I hope you have a good shift. Stay safe, stay protected. Okay.
Thank you. Have fun, guys.
Right. So now that we've introduced all of our crew, we want to go ahead and get started with what we came to talk about. So, coronavirus. We talked a little bit about what it is last time. As of today, the stats show that roughly 4.5 million cases exist worldwide. There's over 300,000 deaths in the world. Now, coming back to our neck of the woods in the US, there's approximately 1.4 million cases and over 88,000 deaths. That's as of this morning. So, this is not getting any slower. It's concerning us. But I wanted to ask you guys a little question, a little quiz, because we talked about this last time, but we're always going to have a little thing that we quiz you on. So, tell me, ladies and gents who are watching, to properly clean your hands, experts recommend washing them with soap and water for at least how many seconds? Or using a hand sanitizer that contains at least what percent alcohol? I'll give you all a minute to think, because I know you didn't think you were coming here for any tests. All right. If you guessed D, you already are halfway where you need to be. Okay, so you're correct. Experts do recommend that we got an A on board. We see some B's there, but experts recommend that you wash your hands at least 20 seconds. So you want to sing the happy birthday song at least 2 times. And as far as hand sanitizer, you want to make sure that it has at least 60% alcohol. That's what's going to make it more effective. And when we say you're halfway there, it's because we know that it's not just about masks about hand washing, but it's also about masks. It's also about social distancing, 6 feet apart. So wash your hands, 20 seconds, 60% alcohol. All right. So now let's get back to business. We actually know that last time you all had a host of questions. The internet was just blowing up with questions for us. And we said, you know what, we gotta answer our fans' questions. We definitely do. We heard you, we've got you covered. And so we're gonna go ahead and ask some questions, or have you ask some questions, and we'll answer. So the first question was from Krista Birch. Tawny, you want to take that question?
Sure. So Krista Birch asked, do we know if this virus will be all year round, or will it be seasonal like influenza? The truth is, we don't really know. A part of the problem is that coronavirus is not well studied at this time. And so we really don't know whether or not this will be something that's short and seasonal like influenza, or whether it will last all year round. Hopefully, as research develops, we'll be able to give you more information on that.
All right, we had a second question from Miss Loretta Mitchell. She asked, hello, ladies. I was wondering if you all have heard about survivors who have PTSD. She said has CHF and diabetes, and she believes she had CHF-related PTSD. And she was wondering about PTSD and coronavirus. I just wanted to start off by saying that it's normal to have an emotional response to something as traumatic as what we're seeing, lots of deaths and lots of people suffering a lot of morbidity. But we don't yet know the effects, the mental health effects that this virus is going to have. I just wanted to point out with regard to PTSD, there are a couple of symptoms that you can look out for in yourself. For example, if you're having invasive thoughts, if you're having nightmares, upsetting memories and flashbacks, you're not able to sleep, increased irritability or trouble participating in your daily activities, it may be time to reach out to a mental health professional. Usually PTSD requires at least a month of these symptoms, but certainly be checking in with yourself about what you're feeling.
All right. Rose Shim asks, can you contract COVID-19 more than once? Truly, even the experts aren't sure. I'm interested in finding out exactly what research will come to support, but as of now, we just don't know.
All right. And so Judy Uko asked, does anyone on the forum know how far away the COVID-19 vaccine is? That's kind of the big word of the day, vaccine. When are we going to get it? And I assure you, if any one of us in this forum knew, we would not be here right now. We would be on some beach because we'd have our own island. We'd be millionaires. No, I say all that just to say that, unfortunately, even the experts don't know when the vaccine is going to hit. There are a lot of promising tests and vaccines going in vaccines that are going on right now. Last I understood, they're going to expedite it. So usually vaccines take years, not months to come up with. But in the case of coronavirus pandemic, with all that's going on, I understand that they are working very hard on it. And we at WDT, when Docs Talk, are going to make sure that we stay on top of it. So when we know, you'll know. Now, we also love the fact that you all not only had questions, but you had a lot of love for our guest last time. We had a guest in the class of 2020 who was graduating but won't get to walk, and several of you congratulated Ashton. We at WDT also congratulate Ashton and all the graduates of the class of 2020. Congratulations. Keep your chin up. You also showed love to the Mullen family. We had Dr. Gina Mullen, whose husband self-deployed to New York to help with the response, and you had lots of love for her. You talked about how her family was full of heroes as she is on the front line and her husband went all the way to New York. You also had love for our guest, Rosie. She was our pregnant nurse who's on the front line, who is also a single mother. You said that she'll be in your thoughts and prayers, and we really appreciate all the love you showed our guest. And we also thank you for the support you've shown us. Lafrida Payne, thank you. I'm glad you appreciate the forum. Eunice Usora, thanks. I'm glad you felt it was informative. And Queensley Udofia, thank you so much. I'm glad that you found us inspirational. So let's go ahead and move on to our next guest. We want to remind you that while you're watching, we would need you to post questions. We want you to know what you're thinking, and all of us here, whether we're on the hosting panel or one of our guests, are ready to answer them. And I want to start off with our first guest, actually, and that is Miss Veronica Anderson. Let's bring her onto the stage. Hi,
Hello.
Veronica.
Hi, how are you?
I'm fine. How are you?
I'm doing good. Thanks for asking.
Excellent. I'm happy you're doing very well. Now, I know you're calling from work. Everyone's on the front line today, huh?
Yes.
So, Veronica, I understand that you have a really compelling story to tell us. And I want you to start off with telling us whether or not you think you have been exposed to COVID-19.
Yes, I think I have been exposed to COVID-19. When I thought that I was exposed, it was around early March, right before, it became so, big in the news. I experienced pretty much most of all the symptoms that everybody else was saying that they were experiencing. I started out experiencing diarrhea. That was my first, and then that was my first symptom. Then I started experiencing to where I didn't have any sense of smell.
Oh.
And I didn't know that until one day my son came home from school, because during this time school was still in.
Okay.
My son came home from school and he said, "Mom, what is that smell?" And I'm like, "What are you talking about?" He said, "It smells like gas." And I'm like, "Gas? What?" And he went by the stove, and the stove knob was actually turned on. I have a gas stove. I didn't know. And I don't even know how long it had been, the gas been on. I must have bumped it or something in some kind of way, turned it on. But to him, it was so strong that he came in the house and had opened up the doors, the windows, and I had no clue.
Wow.
At all.
Veronica, how long were you sick for?
I was sick for about 2 weeks.
Okay.
A little bit over 2 weeks, 2.5 weeks, close to 3 weeks.
Did you ever have to go to the hospital?
I went to the hospital twice. I went the first time when I started experiencing the symptoms, but I just thought maybe, it was just I was coming down with something. I wasn't sure what it was. I just knew I wasn't feeling right.
Yeah.
And but of course I wasn't tested because we weren't doing any testing at the time. The second time I went to the hospital, I was actually on my way to work, and I wasn't feeling good at all. And I noticed that my heart rate was high. My heart rate ended up being like in the 150s. And I was,
I'm going to stop you for just a second because I want our guests to know, our viewers to know, that normal heart rate for an adult is typically less than 90. And so 150s, that means your heart was really working hard. And we usually see that in patients who are dehydrated or infected. And so you were not feeling well. Did you test positive for COVID-19?
So when I got tested, none of my coworkers had ever tested for the COVID-19. So when she tested me, she did a regular flu swab testing on me. I mean, it was a COVID-19 swab, but the technique was more so of a regular flu swab technique. It wasn't, where everybody say you get a brain sample. I didn't experience that.
Okay.
So my test ended up coming back negative.
Right.
So I assumed it was a false negative test, but.
And that's a good point. I actually think you're right. And there's a lot of patients who have told me that they're pretty convincingly having symptoms and they test negative. We should know that the tests are not 100% sensitive, meaning they don't always pick up the disease. And not only that, it's operator dependent. Like you said, they didn't really do a very good swab. It wasn't very far in the nose. And so maybe that's why you tested negative. But I'm happy you recovered. Veronica, tell me a little bit about how this has impacted your family, because when you and I were talking, you had a really remarkable story that I want you to share with our viewers. Tell me about what's happened to your family.
So it started out with my sister. She ended up getting the COVID-19. I'm not sure how she contracted it. I almost kind of felt like she could have gotten it from me because during the time that I was sick, she was around me. But of course, we're not 100% sure. And so she ended up getting sick. She was pretty much had the same exact symptoms that I had when what I experienced in my journey of that whole COVID-19 thing. But not only did my sister get COVID-19, my brother had COVID-19. Wow. My brother's wife had COVID-19. My brother's 3 children had COVID-19.
Oh my goodness. I'm gonna ask you a quick question because I know a lot of our viewers want to know this, especially about children. How old are the children?
The children, they're older kids. They're grown. They're actually not younger kids. So his 3 children were, they all in their 20s.
Okay, all in their 20s.
They're all in their 20s.
All 3 tested positive.
All 3 tested positive.
And you're telling me that your brother actually had a really hard time of it. Tell me about that.
Yes. So my brother ended up getting to a point to where he couldn't almost breathe. And that was the time he felt like, hey, I think I need to go see somebody because I'm having difficulty in breathing. And the day he went, my sister took him to the hospital. And when he got there, he tested positive, of course. And then a day or so later, he ended up being on the vent. He had to be ventilated.
Oh, wow. So he was on a breathing machine to help him breathe.
Yes.
How long was he on the machine?
He actually, thank God, he was on the machine only 2 days before they extubated him.
Okay. Yeah, thank God.
And then, yes. And then also my father. That's the hard one. I mean, my brother was hard too, and thank God he made it. But my father, he ended up contracting COVID-19. And I honestly think that he got COVID-19 from the dialysis clinic. He was a dialysis patient.
Okay.
And pretty much 40-50% of the patients at the dialysis clinic end up contracting COVID-19.
Really?
Yes. And they had like 6 or 7 deaths. there
Oh, wow.
from that same center. So I'm assuming that he contracted it from the dialysis clinic that he attended to. So he was experiencing the same thing. He was running fever. My brother was also running fever. I forgot to mention that. But
Okay.
my dad was running fever. He was getting to the point where he felt like he couldn't breathe. Luckily, my sister, she's a nurse, and she took his saturations, and it was already in the 80s. She said, "Dad, we got to go," because he had been saying he didn't want to go to the hospital. "I think I'm going to be fine. Everything will be okay."
You told me that, when he first got sick, I remember you had contacted me, and you told me that he was thinking he had allergies.
Yes, he kept saying, I mowed the yards, and I think it's just allergies that making me feel this way. And I'm like, "Dad, you mow the yards all the time.
Right.
Allergies does not make you feel like this."
Right. Plus, it doesn't give you a fever, right? Because the fever.
Exactly. Sorry, my little fan falling off. Exactly. But so my sister said, "Dad, I'm sorry. You gotta go. You gotta go. You're running a temperature of," his temp was 103. She said, "You having a temperature of 103. An adult shouldn't have a temperature that high. Plus now your saturations is in the 80s." So finally she took him to the hospital. Of course, she had to drop him off at the front door because she wasn't allowed to go in. And this was in Albany, Georgia, where it was the hot spot of Georgia.
Yep.
And so it was National Guards was at the door. So she had to go through National Guards. And of course, my dad had to get, my sister, they checked everyone's temperature at the door, regardless if you was going in or not.
Okay.
Of course, everybody had to wear a mask.
Right.
And, so she had to do like a intake at the door with the nurse, giving them what his meds and things were.
Okay.
And so yeah, he went in, and they had him on 25 liters of high flow oxygen. And he was on that for a good 2 weeks.
2 weeks so he never was on a breathing machine. He was just on oxygen.
He was just on oxygen. He started out 25 liters of high flow oxygen. About a week and a half, he did get down to 20 liters of oxygen, and close to right at 2 weeks, he was down to 3 liters of oxygen.
Okay.
But the thing is, he had a lot of underlying conditions that also the COVID-19 made it so much worse.
Okay. I know the kidney failure was one of them. That's why he was on dialysis.
Yes, kidney failure. He had cirrhosis of the liver.
Okay.
So he had a stent put in his liver.
Okay.
He ended up getting very confused because of his ammonia levels, ended up getting very high. So at one point he didn't know who we were, unfortunately.
Wow.
But it just got to a point to where he was, his health was just steady declining.
Okay. What happened ultimately?
So ultimately, the doctors called us in and say, "Hey, he's slipping away. His blood pressure now is like 60, I think it was 67 over 22, something like that."
Really low.
And it was really low. And the doctor said that they had him on 3 different medicines to keep his pressure to that point. So technically it was lower than that.
So he was on pressure to bring it up, and it was still very low.
And it was still very low. Yes, he was very toxic. And so they video chatted us early that morning to let us know what was going on. And about 4 or 5 hours later, they said, "Hey, do you guys want to come to the hospital to visit him? We'll gown you up in PPE because we don't think he will make it throughout the rest of the day," which he didn't. So my dad ended up passing. We ended up going to the hospital. He was in ICU. We ended up going to the hospital, and we said our last words. We told him that we loved him, and it was good that we were able to see him, because a lot of hospitals don't let you, in. But we begged, me and my sister, we had to beg and plead, because we kept telling them, "Hey, we're healthcare workers. We know how, to gown up in PPE. Matter of fact, we have our own PPE because we work in, healthcare facility. Please,
right.
Please let us, see our father." And they agreed to. And so we did.
I'm so happy they did that. Veronica, I'm so sorry about your loss.
Thank you.
I know that a lot of people can't even see their loved ones at all. There are some places that they tell them it doesn't matter if you have PPE, personal protective equipment, like the mask and everything, they still don't let them come in. So I'm just thankful that you were able to see him and pay your last respects. And I'm sorry that you lost him.
Yes.
Sorry that you've had so many family members that you've had to worry about their lives, not to mention
my own. And could you imagine what my mom was going through with her husband, her son, you know, her grandkids, her daughters, and she had a lot to deal with. Not only did I have a lot to deal with, but my mother had a lot to deal with, and she still
supporting her and comforting
exactly. Her. I had to stay strong for her because it was too much on her, you know.
Well, Rebecca, I am going to keep you in my prayers, and we at When Docs Talk will do the same. I'm sorry. I'm so happy that you're able to share your story, because a lot of people don't know the kind of symptoms that people have. A lot of people don't realize that once it hits a family, it could spread like wildfire.
Yes.
And I'm happy because a lot of people also think that this is over, that we're, you know, it's fine.
Exactly.
Well, I want you to stay well, be safe.
I appreciate that.
I have to go back to work. I'll see you at work next time, okay?
Okay, thank you. Bye, guys.
Thank you so much. Take care.
Okay, bye.
All right. I want to bring back Tawny because we have another special guest that she's going to introduce to us.
Hey, everybody. So I have the pleasure today of actually introducing my best friend. My best friend is Zoe Shim. She is known to me as my best friend, but to the world, she's known as a counseling and educational psychologist who practices in Jamaica, that's where I'm from. And she's also a teacher, so she wears many hats. She teaches at the University of Technology in Jamaica, and she's been teaching there for over 10 years. Unfortunately, today we get to discuss fortunately, I should say, we get to discuss a more personal aspect of her life. And that's because she's been contending with endometriosis and stage 4 disease. And that has affected her in a negative way, because one of the things that she's been desirous of doing or becoming is a mother. And I know in our last segment, we had an opportunity to talk about mother, and we recently celebrated Mother's Day. And so today I wanted to spend some time talking with her. So without further ado.
Yes, welcome, Zoe. So happy to have you here.
Thanks for having me.
Awesome. So Zoe, let's get right to it. Start by telling us just a little bit about how coronavirus and COVID-19 has impacted your day-to-day life, just generally speaking.
Well, generally speaking, you know, a lot of businesses are now closed. As you said a while ago, I am a teacher, so classes ended immediately and we had to switch to online, which was quite a big transition for many of my students because we're used to the classroom face-to-face setting. Yeah. And now to adjust to the technology of Zoom or whatever medium we had to be passing on the information, especially the fact that it was nearing the end of the semester, it's exam time, crunch time for a lot of stuff. Further to that, you know, a lot of things just went on pause. There was a bit of panic because, you know, Jamaica is pretty small, so information passed very quickly, and we heard about the deaths that it was causing, and so there was a bit of panic as well. But in terms of how it's been since then, everybody's kind of like over it. I'm happy that you gave the warning earlier that, you know, as much as you're tired of this whole quarantine thing, COVID is still very much around, so please stay home. And that's something that we have to be encouraging persons still. Yes. So everything's pretty much essential services only go slow. So it's pretty much the same thing that's happening everywhere.
Okay. So tell us a little bit more. You've told us about how this affects your work environment and how it affects Jamaica as a society. But can you tell us a little bit more about how it has affected you individually and from a health perspective?
Okay, so coincidentally, I was supposed to start IVF treatment just about a week into the quarantine.
Zoe,
And
I'm so sorry to interrupt you, but I just want to make sure that our viewers understand what you mean.
okay,
IVF, in vitro fertilization, in an attempt to get pregnant, right?
right, exactly. And so that was scheduled for about a week into quarantine, and that got postponed. And I've contacted my clinic since, and they're still not sure when they'll reopen. So that's pretty much hanging in the balance. Pretty much just here waiting for a call. And so that's been quite stressful, to be honest. As a psychologist, we're used to the face to face. So that aspect of my career has been, flipped upside down to a certain extent, because now I have to be counseling and doing therapy, so to speak, over WhatsApp video calls, or, just seeing emergency patients in person. So that's really been a big thing for me. So those two aspects, being a psychologist, has really taken a hit, as well as, my whole health thing, because just to reach or contact my doctors, as Tani said before, I have endometriosis, which means that I'm in pain all the time. And so to contact my doctors have been a real issue as well. Just trying to get pain management, pain relief, access to those kind of healthcare facilities, because they've been so strict about persons coming in and all of that stuff. So it's been quite frustrating.
I can only imagine. I want to ask a quick question.
Mm-hmm.
Sorry about the sound. I think it's a little bit echoey, but you're talking about so many things in your life that are on hold, right? So your
Right.
teaching is on hold. All the appointments that you're supposed to have for your process to get pregnancy are on hold. And I just want to, underscore to people that this IVF, something that you've mentioned, is a very big process, right? It's
Right.
very financially consuming, time
Oh, yes.
consuming. So you've already put down the money for it?
I have, thankfully. I was able to put all that money together. Like I said, I was ready to go. I was booked and ready. I had done all my preliminary tests and stuff. So I'm not even sure if I'm going to have to do all of those things over, since it's been 2 or 3 months already since, I should have done it. Further to that, is just wondering, I'm a part of a support group, infertility support group, and a lot of them have been like, is this a sign that I shouldn't be doing this? And it's really hard for me to not take a global pandemic personal. I know it sounds very dramatic, but for a person that's struggling with the decision to do IVF or to do any major decision, to have such a delay with such an indefinite thing, you're almost wondering, like, is this a sign that I shouldn't pursue this? So there's been a lot of time to second guess, because you're stuck at home, there's nobody around, you're left with your thoughts. So on top of everything else, you're on pause and you're left with Dr. Google to see all the things that can go wrong, all the things about COVID happening. So is it even safe to, when they reopen, is it a good time to do it now, or should I wait until this thing has passed? So it has caused even more questions than before. So it's been very difficult, to say the least, and I have to be pulling on the psychology hat to say, I can't take this thing personal. This is a global pandemic. The universe didn't choose to stop treatment for Zoe. It stopped for everybody. You know what I mean? And as much as it sounds very melodramatic, you do have to tell yourself stuff like that, because when these things happen, I've had patients that tell me, I'm supposed to get married this week. Is this a sign that I should marry this guy after all? And so, and I'm sure lots of listeners can relate to that, to say, how can I not take this whole quarantine thing personal? But we do have to tell ourselves that, this is just a test to show how much you really want these things, I think. So
I that you have a very good question. And I understand that as providers, because sometimes it's easy to wear the hat of a provider,
Right.
I don't have a lot of answers for a lot of these questions. What exactly are your doctors telling you?
Well, to be honest, my doctors are pretty much on the front line for COVID. So they're pretty much not very much available for IVF questions. I've sent emails, I've tried calling. Like I said, the clinic has been closed. I got a call last week to say that they are having talks about reopening, but they can't say when. I've been asking, should I continue my protocols in preparation for it? And they're pretty much just like, keep doing what you're doing and we'll call you. Don't call us. So it just kind of left again wondering what you should do.
So once again, it's that whole theme of life on hold. Zoe, I'm so sorry that you're going through this where you feel like everything's on pause. I don't think it's a sign that you're not supposed to do what you want to do. I just think things might take a little bit longer. We're getting from our producer that we have to move on, but I really have enjoyed talking to you. Tawny, thank you for bringing your best friend on the show.
You're welcome. I'm happy she was able to talk with us today.
Yes, and you see we have some guests telling me. Oh, you're welcome. We see some guests telling you, don't give up, fight the good fight. Okay?
Will do.
I'm going to bring on Davida. And I'd like to bring Liz back on too, because we all worked together at one point. So we all worked at one of the busiest EDs in the Southeast, business emergency departments, that is, Grady Memorial. And I don't work there presently, but I wanted to talk to Davida because we always like to phone a friend who's an RN. She's our RN for this segment. And I want her to tell me just briefly about what it's like being at Grady on the front lines as a nurse and how COVID looks there. And I want you to juxtapose that with what you were hearing from a friend of yours in New York, because you did share with me that a friend of yours left Atlanta and went to New York so that she can help as a nurse with the COVID response. So tell me a little bit about that.
Okay, well, there are actually a few friends. So just to give you an idea, the media put out a pretty good warning for people if they weren't in serious medical need for attention, they do not need to go to the emergency department. So our census went down. The people that came in were they experienced COVID symptoms. Okay. So the census was low, the acuity was high, but we were still working to trying to protect staff because like everyone knows, really don't know that much about COVID-19. Right. New information comes out daily about how it's transmitted. So the first thing is to protect ourselves. The access to PPE at Grady, depending on what type of patients you were working with, it was limited. And then when you compare that to the stories that we're hearing in New York, well, first the media, before they even solicited help, the New York government was putting out there that they had nurses that had trash bags on and they didn't have proper PPE.
I remember hearing about that, trash bags and not the right proper gowns.
Right. So when my friends went to New York, they went with a travel company that was saying basically, look, we need nurses. We need you to go now. They didn't have a lot of time to prepare, probably like 2 days, and they were out there. Like I said, we really didn't know anything about COVID-19, so they left to help flatten the curve, not knowing what to expect on the front lines. Okay. They did have PPE, but what they told me did not compare to my experience at Grady.
How so? Less than you did, or they had more?
Yeah, so like I was saying, like Grady is on a regular day is a very busy hospital.
Right. I remember.
Our census went down, but the acuity of the patients or how critical or how sick the patients went up. But we had staff, we had resources, we had PPE. There was an influx of patients. Everybody's there. They have patients sitting in chairs, patients that they're not isolated.
Wow.
At least in our ER, you put these people in a designated room. You let everyone know that if you were to come in contact with this patient, you need to have this type of proper protective equipment. There is no isolation. Everyone is assumed to have COVID-19.
Wow. So, Davida, I'm going to stop you for a second because a lot of people are scared to go to the hospital because they're like, if I go for a heart attack or something completely unrelated to COVID, am I going to be with somebody who could give me COVID? So you're saying that what your friend is telling you in New York is that everyone really is together. There's no isolation, whether you have symptoms of COVID or not.
Correct.
Wow. Now, Liz, I'm going to bring you into this because working in a busy emergency department, I want to know, have you had situations where you've had to intubate patients or do any procedures that would put you at higher risk?
Oh yeah, right when the epidemic sort of got into our consciousness, we were hearing about this disease and about how contagious it was. And at that point, you know, our leadership was ahead of it, sending us emails and talking about how to properly protect ourselves. But it was a totally different experience when you were faced with a patient that was crashing, having difficulty breathing, low blood pressure right in front of you. And as an ER doctor, I told you know, some of my family members, et cetera, there's very little hesitation when a patient is sick, typically. You know, when somebody's sick, you run in the room and your whole staff, nurses, RTs, pharmacists, we're in that room all elbow to elbow, just trying to.
Oh, yeah.
And I distinctly remember the first time I thought to myself, this patient has a disease that you can catch, Liz, that all your staff can catch, the people that you work with on a daily basis. And there was a pause I had never experienced. So yeah, we've had cases, we've had to intubate people. I've had tough discussions with patients about how sick they are, and that's been our reality for the last couple of months.
It really has. And one thing that I always say myself personally, and I tell other people, and it's hard to keep it in our head because, like you said, as emergency practitioners, as emergency doctors and nurses, somebody goes down, we're ready to get on. We're ready to resuscitate you, chest compressions, intubate, whatever has to happen. But I read something that said there is no emergency in a pandemic. And so we have to remember that, like, stop. Even if it's going to take a little bit more time, put on what you need to protect yourself, because if you get sick, like you were saying, Liz, if you get sick and your staff gets sick, that is less patients in the future who are going to benefit from your help. So I think that you're absolutely right to have those thoughts, to take that pause. Davida, I'm glad that they are having some form of protecting you all with personal protective equipment. I'm praying that in New York, it gets a little better. I know that they're overwhelmed far more than we are here in Georgia, so that might be part of the story. But it's just something we have to think about, how we're going to move as doctors and nurses wherever we are, whether you have a few COVID patients a week or every day is COVID central. So with that, I'm going to switch this over a little bit because a lot of our viewers came so that they can hear from our experts in women's health. And we're talking about whenever you have a patient and you're worried about COVID, you have to pause and take your time. There are some things that COVID can wait for, right? So I want our experts to come in, talk a little bit about what they've seen in women's health since this pandemic started and what cannot wait for COVID. So give us a moment and we're going to welcome our experts. Okay. I think we are joined by all of our experts. Welcome, welcome.
Hello.
Hello.
Could you introduce our first guest for us?
Yes, on the bottom right of your screen there, we have Dr. Ujuka Abuchi. Ujuka and I met at Grady as residents, and she's gone on to do fabulous things in the world of OBGYN. So ladies, if you need a women's health expert, reach out to Dr. Ujuka.
Thanks for being here.
Thank you. I'm happy.
You said you're happy to join us.
Yes.
You're excellent. All right. Connie, tell us who else we have here. You're on mute. Unmute yourself for a second, hon.
Perfect. So we have Dr. Alexis Coulter. She's all the way down on the bottom of your screen towards the right, and she just waved at you. I know Dr. Alexis Coulter from our undergraduate and master's education together at Florida Atlantic University. She became a very close friend of mine, and she moved to New York with her husband and her baby. She took them away from me and decided to move north to pursue a career in obstetrics and gynecology. I would love to get, and she's also pregnant, guys. So this is baby number 2. Okay. So I'm big belly to see what she will have to offer us tonight.
There we go. She's definitely pregnant.
Definitely pregnant.
Thank you for coming, Alexis. We're so happy to have you.
No problem. Glad to be here. I wanted to say hi to my son, Malleus.
Oh, Malleus. Mommy says hi. So I have the pleasure of introducing our next expert, Dr. Jenny Getkin. He's here in the bottom middle of the screen. And Dr. Jenny Getkin is the chief of gynecology at the Atlanta VA. She's also an associate professor of medicine at Emory University. She spends a lot of her time and energy in medical education. For over 20 years, she's been in charge of different clerkships, teaching medical students and also teaching medical residents. She's also dedicated to healthcare around the world. She's worked in the Peace Corps in Thailand. She's worked in hospitals in Ethiopia. And she also has been in charge, or at least been part of international clinics here in Georgia that help serve refugee populations. She's amazing. She's a personal friend and a friend of us here at When Docs Talk. So welcome, Jenny Getkin.
Well, thank you so much. That was lovely. I've been lucky enough to teach some people like Ajuka in the past. So that is wonderful to see my trainees come and be so, accomplished.
Yes. Absolutely. I wanted to add Dr. Getkin, almost 5 years ago now, as a fourth-year resident at Emory, you rotate through the VA and spend 6 weeks at the VA working very closely with Dr. Getkin. And it was an amazing rotation. I learned so much of a lot of the skills and things that I still practice now. So it's definitely an honor to be with all of you guys. And yeah, let's get into it.
Let's get into it. So, can I ask each of you the same question? I have the same question for all three of you. COVID can't wait for what? Start with Jenny. Tell me what COVID can't wait for, or what can't wait for COVID.
Yeah, so I would say, most of my life at this point in time is doing GYN. So I will let Ajuka and maybe Alexis talk about the OB side of things, because obviously babies can't wait. And so, and they can talk more about that. But GYN wise, I would say COVID can't wait for acute issues. So chronic pelvic pain, chronic urinary issues, prolapse, things like that people have been dealing with for a long time, unfortunately, sometimes have to be put on hold. Things that should not be put on hold, though, is your new onset pelvic pain. Acute pelvic pain could mean that you have an ovary that has a mass on it and is twisting. And at least in a reproductive age woman, that could mean that ovary could die. And so you can get what's called ovarian torsion, which actually twists on itself, and you could lose that ovary, and that can become an emergency. So acute abdominal pain should not wait. That would be true whether it's gynecological or not. Also, high fevers associated with acute pain could mean that you have pelvic inflammatory disease, which, if untreated, can go on to cause infertility long-term and chronic pelvic pain. And you could also have an ovarian abscess. So those are things that should not wait. The other thing I would think of off the hand is if you're bleeding. A lot of people I see have issues with heavy bleeding, but if you get to a point where your bleeding has gotten you so anemic that you feel short of breath, you can't walk upstairs that you normally could, you feel dizzy or lightheaded, that is the time to, despite COVID, to come into the hospital.
Excellent. Excellent. Those are all great pieces of advice, because a lot of people have asked me in my family, my patients, like, should I come? Is it a little deal? Like, I don't want to get COVID, or I don't want to come if it's not that important. Yeah. I can breathe. I'm not like someone who needs to be on a ventilator. I could just hold this pain in or just deal with this bleeding. So I'm so happy that you laid it out there, Jenny. Pain that's new in your abdomen, in your pelvis, heavy bleeding vaginally, when you haven't had a period in a while, or even if you've had a period, if you're bleeding so much you get lightheaded, don't wait. Thank you, Jenny. Tell me, Ujuka, what can't COVID wait for?
Dr. Getkin definitely covered most of it, but babies cannot wait. And so for us, obstetric care has been pretty much the same. There was some guidance that suggested maybe spacing out visits versus doing more telemedicine. But in my practice as a private practice physician in the suburbs of Atlanta, Georgia, we have found that it was actually safer for our patients to continue our routine obstetric care and bring people in when they needed to be seen. And so babies can't wait. Any pregnancy-related complications or questions cannot wait. I recommend you are in close contact with your physician, with your OBGYN. Make sure that they're aware. There have been some stories in the country, especially in New York City, as the epicenter, where patients had issues getting in touch with their physician. And for us, especially as, African-American women, where maternal mortality may be a little bit higher than the rest of the population, it's very important that you remain and continue your routine of obstetric care. Yeah. Then on the GYN side of it, I agree with everything Dr. Getkin had listed. Abnormal uterine bleeding, especially if it's new onset. It could be a host of things. Some of it could be ectopic pregnancy, and we've had that come in. When I think right off the top of my head, the main reason people were coming in, because even though we're dealing with the pandemic and reduced office hours, we still had some slots for problem visits, and most times it had to do with bleeding, acute vaginitis or vaginal infections, and pelvic pain.
Good. You talked about vaginitis. That's like irritation or inflammation of the vagina, which can be caused by several things, including infections, sexually transmitted infections. So that's another thing that we're seeing, at least I'm seeing in the emergency departments a little bit. If you start to have new discharge, new itching, burning, discomfort, wouldn't you all say that that's something that patients should probably be seen for too and not wait?
Yeah.
Right. Yeah. They should be seen in the office setting, though. I don't think you
office setting. Yep.
Right.
And I agree. I'm glad you said that.
Care for that.
Not the emergency department necessarily. Yeah. If they have access to office settings, because not everybody has access to office settings.
And that is true. So instead of not getting care, then, get the care that you can get.
Absolutely. Alexis, tell us what you think. What can COVID not wait for in your estimation?
I completely agree with everything they said. In clinic, we've been seeing a lot of our OB patients, but I found out that some of them didn't know that we even had our office open. So they missed part of their prenatal care, but we still want to see them all the time. I've been giving labor and delivery phone number to all of the patients because if they have any questions or if they're concerned if they come in or not in, then they can call us because delivery is always open. And we can sometimes, if they're concerned, or let them know, hey, you need to come right now.
Okay. I'm curious, Alexis, because I saw that you're very pregnant. Congratulations. And you're a medical resident. And every one of us on this screen right now has been in residency. And we remember it ain't pretty. It's long hours. It's, very intense learning, but also practice. Tell me, in the age of COVID-19, in New York, pregnant as a resident, what does that look like? With a child at home.
So at first, with another child at home. So homeschooling, exactly. But at first, when all of this started happening, my colleagues, my other residents were scared for me. Oh, probably before I was scared for myself, because I was thinking if I just wear a mask, take all precautions, I'll be fine. And then you really started to see the numbers pick up, and we really had no idea whether this could transfer to the baby, get me very sick. So it started to give me more anxiety. And especially the workload with residency, you don't get as much sleep as you normally would. You're always worried about when you can sleep again, especially in OBGYN. So for me, the biggest part was the kind of when should I stop coming in? Luckily, my administration kind of pulled me out. And also my colleagues would say, oh, she has a cough, you're not going in there, and kind of protect me in that way as well.
That's great.
So I've been thankful for the team that I have has been phenomenal.
That's amazing.
But breathing with the mask is the worst part. Breathing with the mask is the worst part.
You can barely breathe when you're pregnant. Very, very pregnant. It's hard to breathe, exactly. Right? Because there's, that thing's just crapping up on your lungs, and now you have this mask. Oh my God, bless your heart. Bless your heart. I want to go back to my friend Jenny and ask a question, because we were having some conversations, and you said that there's some patients, even outside of OB and outside of acute pelvic pain, that their lives have been put on hold. And I want you to talk a little bit about a special case that you had, because there's certain things that we don't even think of when we think about women's health, and certain people who might need attention, that their lives are on hold too. And I want you to talk about what that looks like.
Yeah. I think your previous guest also talked about the IVF and the infertility, and that's a lot of people that are putting their lives on hold. I think what you're talking about, Dee Dee, is a patient of mine that I have been taking care of who actually had sexual reconstructive surgery. This was, this is a man going in for sexual reconstructive surgery, had already had the breast implants and now was doing the down below part. When she came back to the Atlanta area, sooner than expected because of the COVID, being concerned, because she had to go have the surgery in another country, because we do very few of those here in the US. Then the real concern was the convalescence part. And so with this surgery in particular, it's very important that you dilate the vagina, which is now it's a new tube that has been made. And so like with any reconstructive surgery, you oftentimes have a lot of care for that. And so it was important to keep that dilated on a regular basis. And as it turned out, unfortunately for her sake, some of the sutures came undone from her new labia. And so we've been treating that. So these are things that would not have otherwise happened if she was able to get the postoperative care that would have been available to her if this hadn't happened. Yeah.
Right. So that's another good point, is so it's not only people who have something that started, like the pelvic pain, but also people who are post-operative. Because I have patients who had surgeries immediately before everything shut down. And these are people who would normally have come for a post-operative check, right? They'd go to their doctors to make sure that everything's okay with the incision and that they're doing well, that they don't have infections, and they've had to stay at home. So this is a case with this reconstructive surgery where I understand if you don't dilate the vagina, it can actually close, and the whole expensive, laborious surgery would be in vain.
Yes.
Is that correct?
And very expensive, very laborious. Again, this poor patient had to go overseas to have this done. So yeah, it would be all in vain.
Okay.
Luckily it's not. Luckily we've been able to see her and take care of her, but yeah.
Yeah, this is great information, ladies. I just have a general question for you all. And thinking back to our previous segment, our guest was asking about whether she should go ahead with pregnancy. And I'm just curious about how you guys are counseling women who are trying to make the decision about whether they should get pregnant in these times. And two, are you telling the women who are currently going through a pregnancy?
Right. It's hard. There's so much that's unknown about COVID-19 and the pandemic that if you are trying to get pregnant on your own and you're home in a committed relationship, I wouldn't put that on hold, because sometimes you're able to get pregnant in 1 month and sometimes it takes years to conceive. So you don't know how long that's going to take. We don't know how long the pandemic is going to last. So I wouldn't put that on hold. Now, if you are undergoing procedure like IVF, then it's a little bit out of your control, and you'd have to seek the care of physicians and go into offices. So that becomes a little more difficult, because now not only is your process being affected by what you can do, but also you need the care of other physicians. And so that's hard. But the good news is at most hospitals, at least I can speak at the hospital that I work at, we are starting to do elective cases again. We actually, for the past week, started with a small schedule for elective surgical GYN cases. And now we're planning before the end of the month to ramp up to a normal schedule. And that's because, our hospital has been watching the rate of transmission in the community and our availability of hospital beds, our availability of PPE. And we feel that we can handle having all those cases, and potentially if we had an onslaught of cases from COVID. So we felt comfortable doing that in our hospital. So if you are undergoing IVF, getting in contact with your physicians, like Zoe had mentioned, they had told her she's done the right thing and being proactive to try to contact them. And they told her to hold on. Some places you may try to contact them and they may not tell you to hold on. As a matter of fact, I have a patient recently who I did a procedure on in preparation for IVF, and she's going to be traveling to California to do it. So in the US, it varies by location, it varies by community. I would definitely say your doctor will be the person to give you that information.
And as a follow-up, like the American College of GYNs has put out sort of a lot of question marks, and in many areas we don't know what consequences of this virus are. I was interested to see that the UK's version of ACOG had made some sort of different recommendations about women working in environments where they may be exposed to COVID, for example. Was wondering about your thoughts on that environmental work or environmental exposures.
Good question.
Yeah. Well, I will say, having a chair that previous worked for the CDC and being sort of having her finger on the pulse of things, generally speaking, pregnancy doesn't seem to increase people's risk. We don't know. And so if you can avoid, as with the Alexis, if there's a situation where somebody can avoid being in contact with what we call as persons under investigation and or people as positive for COVID, it's probably a good idea simply because we don't know. But in this disease, we don't see any evidence that pregnancy, certainly unlike flu and other diseases that we see in the past, that pregnancy puts you more at risk. So I can simply say that. So for our department, we actually didn't make any changes based on people's pregnancy status as far as working goes.
Great.
Right. Last question.
Sure.
Question at the bottom of the screen.
Yes, that's what I wanted.
I heard about hospitals that are testing all of their women that are being admitted to the hospital for delivery, and they're seeing as high as 15% of women being positive and asymptomatic. I was curious if you guys are seeing a similar percentage at your hospitals.
So we are actually, again, it depends on the region and the demographics and community transmission rates. I think at our hospital, we're not doing generalized testing. Now we're testing certain surgical patients, but we're not testing asymptomatic patients. So it's more of a risk stratified procedure. So if you screen positive or have symptoms, then you would get tested. And then your newborn would also be either separated or tested if, either of you is positive. We definitely limited traffic on the labor and delivery units. There's very limited visitors, usually one visitor per patient. And that is a huge shift. If you imagine for the moms on the screen, when you had your babies, usually there's at least 2 or 3 people in the room. Now we're limited it to just one person to be there with the mom. And that person can stay the duration of the time. You can't switch out and, the grandma comes for a few hours and the dad goes back. No, it's just that one person. So our patients are struggling with that. But I think at the moment, everyone has made adjustments in some way or form dealing with the pandemic. And the response has been favorable. Again, we're in the suburbs, so our population is a little bit different than Grady or I would say inner city Atlanta. But I would, what I would say is for your question, Liz, about pregnancy, in real life, many patients are very concerned and they come asking us for work excuses or to be put out of work. And we've done, like Dr. Getkin mentioned, to really allay their fears and let them know that we don't have evidence that pregnant women can suffer a more severe form of the disease. And in that case, if you can continue to work, you can continue your career, because sometimes stopping work, not everyone has the financial ability to stop working. But in cases where there's a real risk, where maybe they have a job that requires a lot of interaction, person-to-person interaction, we have provided excuses or letters to the employer, allowing them to either take their maternity leave a little bit earlier or also allow them to work from home. And that has also been favorable for our patients.
Excellent. Well, I know that a lot of our viewers had questions about pregnancy, about just general women's health. I know they had questions about how you all are dealing either as mothers or pregnant women, and you all have done a wonderful job of answering those questions for our viewers. What I want to let our viewers know is that if there are any questions that you didn't hear answered or anything that you think of later, please feel free to visit our webpage at Facebook, When Docs Talk, post them there. And as you saw with this episode, we always circle around and answer your questions on the next episode. So don't feel like your questions won't be asked. But at this point, I'm going to thank all of our experts for coming. Thank you for your dedication to your patients. And thank you for helping our viewers understand what they need to know, what COVID can't wait for, and letting them know that there are still people that they can go to, even in this pandemic, when they need help with women's health. Thank you so much.
Thank you.
Thank you for having us.
All right.
Stay safe, stay sane.
Thank you. I want to bring back on our crew to leave some departing words. And we are waiting for Davita. There she is. All right. So Sonia couldn't be here, as you saw. She was in the beginning. She's back at work. But for the rest of us here at When Docs Talk, we wanted to leave some departing words about what you can do to optimize your health, words of advice. Tawny, what words of advice or what take-home points do you want to give our ladies or our viewers today?
I think one of the ones that's kind of rested on my heart as I was kind of thinking about this before the show was always remember who your experts are. And always remember that whatever issues you're experiencing, whether it be as a woman or a man, there's always someone out there who has some experience with this or who can provide you with support during this time. I know that it can be very easy to feel isolated during these times. And so it's super important to kind of lean on the people who are essentially going to be resources for you.
Excellent. Liz, anything for our viewers?
Yeah, there's a theme that's been sort of going around social media, and that's that just because we're tired doesn't mean that it's over. And so I just want to continue to encourage people to be cautious, continue to wash your hands, continue to stay vigilant, continue to wear your masks because we're just not sure what's going to happen.
Absolutely. It ain't over until it's over, and it's certainly not over. Davita, you have viewers.
Yeah, Liz definitely made a point. Safety is priority. Mask up, use proper hand washing hygiene, try to limit exposure. Just because our governor decided to open up a lot of businesses does not mean that it's okay for everyone to go out. Try to exercise some common sense at this time because at the end of the day, you need to protect yourself and your loved ones.
Absolutely. Thank you for that. And talking about exercising caution, let's also talk about exercising self-care. I want to leave with our viewers the thought that you have to care for yourself. And what does that look like when you're cooped up in your house all day? That looks like taking a moment to go outside and just stand in the sun. That looks like listening to your body. If something doesn't feel right, don't be scared to seek care. Don't be scared. Maybe you can reach out virtually online first, but if something is keeping you up at night, something is making you very concerned, you need to come in to an emergency setting, and we're happy to see you. We in the emergency department are there 24/7. Now, we're not asking everybody to rush in all the time, right? But if something is painful, something is not allowing you to breathe, something is hurting your chest, those are things to come in. So listen to your body, exercise self-care, and try and form any kind of human connection that you can. So we're looking at each other through screens all day, every day. Call somebody, tell them you love them. If there's somebody in your home, touch, touch. That human touch is so important. And that's what I'm worried about us all losing, because so many of us, especially if we don't have people in our homes, aren't touching anybody. And that's what I pray for all of us, because it's not a good feeling. I also want to leave with you to seek out information. There's a lot on the internet. There's a lot everywhere, but seek out information from experts, from people who have studied this, people who have their hand on the pulse of the nation, pulse of healthcare, and not just so-and-so on Facebook sent me a meme. So be very careful about that. With that, we want to be a source of information for you. We want to be a source of self-care. We hope that you have enjoyed our series, Sheroes. As I said last time, all of you women out there are Sheroes. All of you women out there are trying to make this work with COVID-19, and we salute all of you. So take care of yourselves, and please tune in next time. We are going to have a great show. Fellas, if you're out there, this is when you come in.
Yeah.
It's not a woman's show. We're bringing in the men. We are bringing in the men on May 31st, 7 p.m. We are going to talk about sex, dating, and intimacy in the age of the coronavirus. What are you all doing in your homes? Not. So please tune in then. We're going to send out some ads, start thinking about questions that you want to know, who's touching, who's kissing, who's still doing online dating. We're going to talk about it. We thank you so much for joining us at When Docs Talk. We'll see you next time.
Bye.
auntie, cousin, shy, pretty. Fearless leader, soulmate, great. Older, boss, brilliant, soldier. Cute, flawless, sexy, lawless. Mother, wife, sister, daughter.